Welcome to Getting Started with Brain Power, our tutorial video designed to provide you with the background and procedural knowledge to get set up as a Brain Power provider, a support trainer, or as an independent home user. First off, let's provide some clinical background. The term processing disorder is a general one that applies to any structural cognitive problem associated with mental processing. Processing disorders can be congenital, existing at birth. These can manifest in impaired executive functions, organization, planning, judgment, impulse control, as well as auditory, visual, and language processing, all of which affect memory and learning. Often referred to as learning disabilities, these disorders, if left untreated, can cause a lifetime of frustration and personal defeat. Processing disorders can also be the result of injuries, such as brain injuries caused by mild to severe head trauma. With our active lifestyles of travel, sports, and adventure, the frequency of brain injuries is on the rise. Those accident victims frequently suffer long-term cognitive problems, commonly being referred to as walking wounded, often receiving little or no clinical attention after the initial treatment of the acute injury. The Brain Power Cognitive Skills Training Program was professionally engineered to provide the frequency, intensity, and duration of treatment required for maximum neurological development, all in the privacy of the patient's home. By making it possible for the patient to affordably receive daily 1-hour sessions for 12 weeks or more, Brain Power delivers real results that stimulate permanent neurological development, along with improved cognition, reasoning skills, and real-world academic and job performance. Also engineered into the Brain Power program is the highest degree of treatment flexibility ever offered. Brain Power can be professionally administered, getting all the benefits of daily home-based treatment with professional oversight. It can also be skillfully administered by committed home users, if they are unable to find a local Brain Power provider or simply prefer to work independently. Let's explore these treatment options further. Brain Power can be recommended by or professionally administered by a wide variety of healthcare professionals. Literally any professional who encounters individuals suffering with processing disorders can enthusiastically recommend the Brain Power program for home use. These could include professions as diverse as educators, doctors and nurses, psychologists, and even personnel managers. In short, anybody who sees the impact of processing disorders can confidently recommend that individuals become home users of the Brain Power program. Those professions and facilities that are directly involved in cognitive development and rehabilitation are encouraged to take the important step of becoming a Brain Power provider. Those would include neuropsychologists, speech pathologists, occupational therapists, special education professionals, hospital rehabilitation departments, as well as outpatient rehabilitation clinics. Brain Power provides the ultimate flexibility to the professional, allowing them to simply recommend the program, or provide minimal support and guidance, or be intimately connected with needs assessment, treatment planning, and professional monitoring and oversight of this impressive home-based treatment regimen. As previously stated, if there's a desire to work independently, or there simply isn't a Brain Power provider accessible, we offer the option of registering as a Brain Power home user. It's important to know that there are two distinct components of a successful treatment program utilizing Brain Power. Number one is the diagnosis, needs assessment, and treatment planning required to target and treat specific processing disorders. Number two is the implementation of this home-based treatment program, maintaining the frequency, intensity, and duration of treatment required for maximum cognitive development. It's imperative that anybody registering as a home user take their responsibilities seriously, completing all the video tutorials and competently assessing the needs of the patient, with professional help if needed. Since Brain Power is a home-based treatment program, ultimately every Brain Power patient becomes a home user of sorts. Brain power treatment is administered with the help of what we call a support trainer, usually a family member or a friend. The support trainer, by completing our free video-based trainer orientation program, receives the necessary education required to effectively administer the Brain Power program, including needs assessment, treatment planning, and the training skills required to implement a targeted cognitive skills training program. Every home user can also get support from Brain Power Direct, even providing clinical support if desired. Let's get started by going to the Brain Power website at www.trainmybrain.com. By going to the Getting Started tab at the top of the home page, you will see several options. The overview will provide you with the guidance required to get registered and set up as a Brain Power provider or home user. It is here that you can download the Brain Power program, locate a provider, and access important information. The first real step in getting started with Brain Power is registration. By going to the Registration tab, you can choose Professional or Home User. If you are a professional organization desiring to offer Brain Power to your patients, then choose Professional. If you are a patient or family member desiring to use Brain Power, you can register as a home user by selecting Home User. In either case, you will be asked to provide basic user information and primary contact information. You also create your password, which will provide you with login access to the Brain Power program as well as the Brain Power website with complete administrative functionality over your account. In the case of home users, patient enrollment will be required during registration, getting the home user fully prepared to complete the trainer orientation and begin patient treatment. In the case of the professional provider, patient enrollment will be done at a later time as part of their normal administrative functions. Our tutorial video entitled Administrative Management will cover that in detail. After registration and website login, the Brain Power program can be downloaded at any time and on as many computers as you desire by going to the Getting Started tab and selecting Download. Just follow the standard download procedures and follow up by installing the program. For convenience, we recommend that you create a Brain Power shortcut and place it on your desktop. This will make it easier for you to easily access the program for your daily training regimen. Once registered, you can log into the Brain Power website at trainmybrain.com. Enter your username or the email address that you registered with, along with your chosen password. After logging in, you will notice a new series of administrative tabs. We will offer more information on this functionality in our tutorial video on administrative management. Suffice it to say that this is where you achieve full administrative functionality for adding patients, setting up treatment plans, and assessing training performance. There is also a wealth of knowledge with accessible reference tabs and orientation tutorials. Opening the Brain Power program is as simple as double-clicking the icon on your desktop and logging in. Please note, login access is restricted to registered users with an enrolled patient. As mentioned, home users will have registered and enrolled their patient as part of the registration process, whereas professional providers need to enroll individual patients that are to begin training using the administrative functions on the Brain Power website. Once logged in, you choose the patient's name and the program will open, accessing the database specific to that patient's training. Since training is incremental, the patient always starts at level 1 and proceeds to the next level only upon completion. All training history is recorded and accessible in report form utilizing the Overview tab at the far right. Every time the patient logs back in for a training session, they begin where they left off in the previous session. Navigating the program is simple. All training domains are listed along the top, and associated modules within those domains are listed on the tabs below. Within each module are up to 32 training levels, with each level becoming incrementally more challenging. You can also log into the website directly from the program by hitting the Go to Website tab in the upper right-hand corner. You will be automatically logged in and have access to all administrative and support pages. A strength of the BrainPower program is that it is computer-based, accessible through multiple computers, and connected via the internet to patient information, training history, and administrative management. What this means to both the BrainPower provider and home user is that treatment is convenient and flexible, and so is professional monitoring. This convenience sets BrainPower apart, allowing training to take place at home, on vacation, at work, or in fact on virtually any computer with an internet connection, assuming you have permission to download the program. BrainPower provides convenience, effectiveness, and affordability, all the ingredients of a successful cognitive skills training program. Thank you for watching Getting Started with BrainPower. We hope you've enjoyed this summary overview of the BrainPower program, its clinical applications, and the simple steps required for you to get started using it. Whether a professional provider planning to help multiple patients suffering with brain injuries, learning disabilities, or other cognitive disorders, or a home user with one specific patient in mind, the results are the same: enhanced cognitive function with increased real-world performance.